Have you ever noticed your legs suddenly swelling, a dull ache lingering, or one thigh feeling unusually warm for no apparent reason? Or perhaps you were feeling perfectly fine and suddenly experienced shortness of breath, a racing heart, or a tight chest, thinking it was just stress, weather changes, or lack of sleep. But did you know? These could be early warning signs of a silent killer called a blood clot, a condition responsible for millions of strokes, heart attacks, and sudden deaths each year, often without any prior warning. In today's video, I'll share with you 12 warning signs of dangerous blood clots, the subtle signals your body is trying to send you, yet they're so easily overlooked. More importantly, I'll help you understand why these signs matter, the mechanisms behind them, who's at higher risk, and when you absolutely must seek medical attention to protect yourself and your loved ones. Don't take your eyes off the screen. The information I'm about to share could save your life or the life of someone you love. So, how can you tell if a blood clot is silently forming inside your body? Let's break it down from the smallest, seemingly harmless symptoms, which might just be the body's first distress signals before a major event. Unexplained swelling in one leg or arm. This is the most classic and common sign of deep vein thrombosis or DVT, particularly affecting the lower limbs like the calves and thighs. When a blood clot forms inside a deep vein, it blocks normal blood flow back to the heart. As a result, blood builds up behind the blockage, causing fluid to accumulate in the surrounding tissue, a condition known as edema. Swelling typically occurs on one side, which is a crucial clue that helps differentiate DVT from generalized swelling due to systemic issues like heart failure, kidney, or liver disease, which usually causes both legs to swell. In addition to swelling, the affected limb may feel heavy, tight, and mildly warm. The skin may turn reddish or purplish, and even feel tender when touched. Individuals who have undergone major surgery, been hospitalized for extended period, remained immobile for too long, such as during long flights or post-injury bed rest, or are taking hormonal medications, all fall into the high-risk category for DVT. If you notice unexplained swelling like this, do not take it lightly. It could be the first sign of an impending pulmonary embolism. The most dangerous complication of DVT. 2. Leg pain or tightness that feels like a cramp. A blood clot doesn't always cause noticeable swelling at the onset. One of the earlier and easily overlooked symptoms is a persistent, dull ache or tightness in the calf. Many describe it as a mild muscle cramp. But what sets it apart is that the discomfort doesn't go away with rest, massage, or a change in position. Pain from a clot is usually localized. You'll feel it in a specific area, often along the path of the deep veins in the calf or thigh. Unlike typical muscle pain, which tends to be more diffuse, the pain tends to worsen with prolonged standing or walking and may ease when you elevate your leg. Because the pain is vague and there's often no clear swelling, people tend to dismiss it. However, if you have any risk factors, such as recent surgery, prolonged sitting, cancer, or are on birth control, you should pay close attention if you experience this type of pain. In many cases, it's the body's first red flag signaling a blood clot, and timely action can be life-saving. 3. Swelling with warm and discolored skin. One critical symptom that should never be ignored when suspecting a blood clot is a noticeable change in the skin over the affected area. Often following swelling, you may begin to observe the skin becoming red and warmer compared to the opposite limb. This results from a localized inflammatory response silently occurring inside the blood vessel. When a blood clot forms and obstructs the return flow of blood to the heart, the pressure within the vein increases, causing fluid to leak into surrounding tissue and triggering an inflammatory reaction at the site. Inflammatory cells such as neutrophils and macrophages are mobilized to the area. This immune activity raises the skin temperature, making the area feel warm. A physiological reflex as the body attempts to respond to an abnormality within the vessel. Skin discoloration, ranging from red or pink to bluish purple, reflects the degree of oxygen deprivation in the tissue. Initially, due to increased blood flow and local capillary dilation, The skin may appear reddened. However, if the blood clot enlarges and completely blocks the vein, oxygen delivery is cut off, turning the skin bluish-purple, dark, or pale gray. This is a serious sign, indicating severe ischemia. The tissue is essentially suffocating. If this persists, blisters or skin peeling may begin to appear, an indication that tissue necrosis has set in, as the tissue is no longer receiving adequate nourishment and is starting to die. At this stage, the condition is no longer just localized inflammation, but may progress into acute vascular occlusion, requiring emergency intervention. Without prompt treatment, limb function may be lost, or the condition may even become life-threatening if the clot travels to the lungs or brain. In short, if you notice swelling accompanied by a sensation of warmth and redness, unusual skin discoloration, especially bluish, gray, or darkening tone, or blistering or cold, numb skin, these could be signs of serious conditions like infection or poor circulation. It is important to seek immediate medical attention to prevent further complications. Do not delay. This is not a case of simple dermatitis, but a warning sign of a dangerous thrombotic condition requiring immediate medical evaluation and treatment. Sudden chest pain with shortness of breath. If you suddenly experience chest pain, sharp like a stabbing sensation or tight as if being squeezed, along with shortness of breath, difficulty breathing, or even fainting, this is far more serious than simple fatigue or stress. It could be a hallmark sign of a dangerous and acute condition. Pulmonary embolism, or PE. Pulmonary embolism occurs when a blood clot, usually originating from deep veins in the leg, breaks loose, travels through the bloodstream, and becomes lodged in the branches of the pulmonary artery. This blocks the flow of blood from the heart to the lungs, severely impairing gas exchange and the body's oxygen supply. The chest pain caused by a pulmonary embolism (PE) has very distinctive characteristics. It is a stabbing, knife-like pain, unlike the left arm radiating pain typically associated with heart attacks. The pain worsens with deep breathing, coughing, or changes in position, which is a key feature that helps distinguish PE from other cardiovascular conditions. It is often accompanied by intense shortness of breath, the feeling of not being able to take a full breath, even while resting. Many individuals may also experience a racing heart, palpitation, cold sweats, dizziness, or even temporary loss of consciousness. These symptoms require immediate medical attention, as PE is a life-threatening emergency. In severe cases, a large clot can block nearly all blood flow to the lungs, leading to acute respiratory failure, cardiovascular collapse, and death within minutes to hours if not promptly treated. Alarmingly, many people with PE have no prior obvious symptoms or only mild signs like a dull calf ache or one-sided leg swelling, before suddenly progressing to acute shortness of breath. This is why PE is often diagnosed late or missed altogether without a high level of awareness from both patients and healthcare providers. High-risk groups for pulmonary embolism (PE) include post-surgery patients, especially after abdominal or orthopedic operations, individuals with prolonged immobility, such as bedridden patients or those in long-term hospital stays, postpartum women, and users of estrogen-containing contraceptives, cancer patients, individuals with obesity, and those with a personal history of blood clots are also at higher risks. If you or someone close to you experiences sharp, stabbing chest pain, sudden shortness of breath, or an unexplained rapid heartbeat, seek immediate medical attention. This is a medical emergency that must be addressed within the first hour to minimize the risk of death. Time is critical in the treatment of pulmonary embolism. Dry cough, coughing up blood, rapid heartbeat. When someone develops a persistent cough with no clear cause, accompanied by a scratchy throat, hoarseness, or even coughing up blood, it is easy to mistake it for a common respiratory condition, such as bronchitis, pneumonia, or asthma. However, in the context of recent surgery, prolonged hospitalization, or extended immobility, these symptoms could be alarming indicators of progressive pulmonary embolism (PE) a dangerous complication caused by blood clots. Why does coughing occur in pulmonary embolism? A blood clot lodged in the pulmonary artery blocks blood flow to the alveoli, the tiny air sacs in the lungs where gas exchange occur, causing a severe oxygen deficit in the affected lung area. In response, the lung tissue triggers a cough reflex to clear the obstruction, even though there may be no mucus or infection. In some cases, ruptured pulmonary capillaries may cause the patient to cough up blood, a red flag that requires immediate medical attention. Rapid heartbeat, a critical compensatory mechanism. When oxygen levels in the blood drop, the body quickly responds by increasing heart rate to deliver more blood, and therefore more oxygen, to vital organs. A fast heart rate is not a disease itself, but a survival response, signaling that the body is in a state of hypoxia or hemodynamic instability. Unfortunately, this can be easily missed if the pulse is not closely monitored. What makes these symptoms especially dangerous? Pulmonary embolism often presents with vague symptoms in its early stages. The patient might only experience mild cough, fatigue, slight shortness of breath, or a subtle increase in heart rate symptoms that can easily be misdiagnosed as a cold, asthma, or upper respiratory infection. However, within hours, the clot can grow or spread, leading to respiratory failure, sudden drop in blood pressure, cardiovascular collapse, and death if not properly managed. Be particularly vigilant in the following cases. Individuals who have recently undergone surgery, especially abdominal or leg surgery, as they are at a higher risk of developing blood clot, patients on prolonged bed rest, those who are immobile, or individuals taking long-haul flights should also be closely monitored, as extended periods of immobility increase the likelihood of blood clot formation. Cancer patients or those with a history of blood clots or vascular disease are also at an elevated risk for pulmonary embolism. Pregnant or postpartum women, and those using hormone therapy or estrogen-based contraceptives, are similarly at increased risk due to hormonal changes that can promote clotting. These individuals should be cautious and seek medical attention immediately if they experience symptoms of a pulmonary embolism. If you or a loved one develops unusual coughing, coughs up blood, experiences a rapid heartbeat along with chest pain or shortness of breath, especially if you belong to a high-risk group, treat it as a medical emergency. Call for help or head to the hospital immediately. Severe headache, vision changes, one-sided weakness. Among the most critical complications of blood clots, ischemic stroke is a top-tier medical emergency that can strike without warning and leave devastating consequences if not treated promptly. The primary cause is a clot traveling to the brain and obstructing an artery supplying blood to neural tissue. As a result, brain cells are quickly damaged or die from the lack of oxygen and nutrients. The most common symptom when brain tissue is acutely injured, patients often describe it as a thunderclap headache, intense, spreading, or localized pain that does not improve with rest. Facial drooping, slurred speech, changes in voice. If the stroke affects areas of the brain controlling facial muscles and speech, the patient may have difficulty speaking clearly or be unable to speak at all. Vision disturbances. This may include blurriness in one eye, double vision, or temporary vision loss. These are signs that the clot has impacted the brain's visual processing centers, numbness, weakness, or paralysis on one side of the body. The person may be unable to lift one arm or leg, or may experience tingling. Lack of coordination, or muscle weakness in one side. Understand the principle, time is brain. Once a clot blocks blood flow to the brain, millions of neurons die every minute. Therefore, the sooner a patient is brought to a medical facility, the better their chance of full recovery and avoiding permanent disability. Neurologists emphasize, the golden window for treating clot-related strokes is within 3 to 5 hours of symptom onset. During this time, doctors can administer thrombolytic clot-busting medications like RTPA to dissolve the clot and restore cerebral blood flow. To quickly recognize and act on a stroke, remember the FAST acronym. F for face. Ask the person to smile and check for facial drooping. One side of the face may appear uneven or sagging. A for arms. Ask them to raise both arms. If one arm drifts downward or cannot be lifted, it could be a sign of a stroke. S for speech. Ask them to repeat a simple sentence. If their speech is slurred or they have difficulty speaking, it could indicate a stroke. T for time. If you notice any of the above signs, call emergency services immediately. Time is crucial in treating a stroke, and quick action can help minimize damage. 7. Sudden unexplained severe abdominal pain. Not all abdominal pain originates from the digestive system. One of the most dangerous but lesser-known causes is a blood clot in the mesenteric artery, the major artery supplying blood to the small intestine and parts of the colon. When a clot blocks this artery, blood flow to the intestines is abruptly cut off, leading to acute mesenteric ischemia. The intestinal tissue quickly becomes damaged, resulting in inflammation, necrosis, sepsis, and even death if not treated promptly. This is the hallmark symptom. The intensity of pain is often disproportionate to physical findings on examination. The abdomen may feel soft, yet the pain is extreme, does not respond to standard pain medications, may be accompanied by nausea, vomiting, diarrhea, or bloody stools. In advanced stages, there may be low-grade fever, abdominal distension, rapid heartbeat, and low blood pressure. High-risk groups for stroke include elderly individuals, especially those with underlying conditions such as atrial fibrillation, heart failure, or blood clotting disorders. People who have recently undergone abdominal surgery or heart vascular transplants are also at higher risk. Additionally, patients with cancer, severe dehydration, or sepsis are more susceptible to experiencing a stroke. These individuals should be monitored closely for any signs or symptoms of stroke, as they may be at an elevated risk due to their health conditions or medical treatments. Mesenteric thrombosis is a surgical emergency. If left untreated for just a few hours, the bowel can undergo irreversible necrosis, potentially requiring surgical resection or resulting in death. Therefore, any unexplained abdominal pain in high-risk individuals must be evaluated promptly to rule out a vascular emergency. Do not delay seeking medical attention. 8. Dull lower back or pelvic pain. Unlike blood clots that block arteries and cause sudden symptoms, pelvic vein thrombosis often progresses silently. It presents with vague signs, easily mistaken for musculoskeletal pain in the lower back or even sciatica. The internal and external iliac veins are large vessels that return blood from the legs and pelvic region to the heart. When these veins become obstructed by a clot, blood pools in the area, leading to dull aching pain in the lower back, hip, or pelvis. More commonly on one side, easily overlooked symptoms of pelvic vein thrombosis include persistent, dull pain in the lower back, buttocks, or pelvis lasting for several days. This pain may radiate to the inner thigh and worsen with prolonged standing or walking. It may also be accompanied by unilateral leg swelling or an unusual heaviness in the affected leg. Notably, this condition does not improve with muscle relaxants or standard painkillers, making it difficult to differentiate from other types of musculoskeletal pain. People at higher risk for pelvic vein thrombosis include pregnant or postpartum women, due to the enlarged uterus compressing the iliac veins. Individuals who have undergone recent abdominal or pelvic surgery, especially gynecological or urological procedures, are also at greater risk. Patients who have been immobilized for long periods, such as those in intensive care or with spinal cord injuries, should be monitored carefully. Additionally, those with inherited clotting disorders or acquired hypercoagulable states, such as lupus or cancer, are more susceptible to developing this condition. Why should you be vigilant? Because pelvic vein thrombosis can extend upward into the inferior vena cava, increasing the risk of pulmonary embolism, a potentially fatal condition if the clot dislodges and travels to the lungs. Early diagnosis through Doppler ultrasound or CT venography enables timely anticoagulant treatment to prevent severe complications. 9. Skin turning blue or purple. One of the late but extremely dangerous signs of a blood clot is the appearance of bluish or purplish discoloration of the skin, especially at the fingertip, toe, or a localized area of the body. This indicates that blood flow to the tissue has been almost completely blocked, causing local oxygen deprivation. The human body functions properly thanks to a constant supply of blood delivering oxygen and nutrients to every cell. When a large clot completely obstructs blood flow, the affected tissue loses its oxygen supply, becomes bluish or purple, feels cold to the touch, and may progress to tissue necrosis if not treated promptly. In severe cases, particularly in patients with underlying conditions such as diabetes, atherosclerosis, or peripheral artery disease, even a small clot can reduce blood supply to the limbs, leading to ulcer, infections, gangrene, and potentially amputation. One particularly serious condition to be aware of is phlegmasia caeruleus dolens, which typically affects the lower limbs. This is an advanced form of deep vein thrombosis (DVT), where the clot is so large that it completely obstructs deep venous outflow, causing the leg to become massively swollen, dark purple or black, excruciatingly painful, and cold. Without urgent treatment, this condition can lead to limb gangrene, sepsis, and death. This is a life-threatening medical emergency. Immediate intervention with thrombolytic therapy, clot aspiration, or surgery can save both the affected limb and the patient's life. 10. Sudden unexplained shortness of breath. Shortness of breath is not always caused by respiratory diseases. If an otherwise healthy individual with no history of asthma or pneumonia suddenly experiences difficulty breathing, unexplained anxiety, or a rapid heartbeat, pulmonary embolism, PE should be considered, especially if they recently experienced prolonged surgery, extended bed rest or immobility, long-distance travel by plane or car, or recent childbirth, or a history of blood clotting disorders. This shortness of breath may present as difficulty breathing with exertion or even at rest, inability to take a deep breath, needing to sit upright to breathe, sharp chest pain, often worsened with deep breaths, along with a rapid heartbeat, and dizziness, cold sweats, or even fainting. From a physiological standpoint, when a blood clot blocks a pulmonary artery, blood from the heart can no longer reach the lungs to exchange gases, resulting in severe oxygen deficiency. This triggers an intense response from the nervous, cardiovascular, and respiratory systems. The danger lies in how easily PE symptoms can be mistaken for panic attacks, pneumonia, or psychological stress, causing patients to delay seeking care. However, early diagnosis and treatment with thrombolytics, anticoagulants, or interventional procedures can lead to excellent recovery outcomes. 11. Superficial phlebitis. Superficial phlebitis is an inflammation of veins located just beneath the skin, most commonly affecting the lower limbs, especially along the great or small saphenous veins. Typical signs include a red, mildly swollen, tender streak along the course of a vein, a burning sensation following the inflamed vein, and tender, sensitive skin over the inflamed area. Unlike deep vein thrombosis (DVT), superficial phlebitis rarely causes immediate life-threatening complications. However, it serves as an important warning sign that the body may be in a hypercoagulable state, particularly in individuals with a history of recurrent phlebitis, chronic varicose veins, cancer or inherited clotting disorders, and those on hormone therapy or using oral contraceptives. If not properly monitored and treated, superficial phlebitis can extend into the deep venous system, leading to DVT. Furthermore, persistent inflammation damages the vascular endothelium, increasing the risk of widespread clot formation. Treatment includes warm compression, anti-inflammatory medications, compression stockings, and close observation. In cases involving accompanying thrombosis, anticoagulants may be prescribed depending on the level of risk. Below, unexplained rapid heart rate. The heart is the core of the circulatory system. When a blood clot causes a pulmonary embolism, coronary artery blockage, or leads to systemic hypoxia. The heart compensates by increasing its rate to make up for the lack of oxygen and blood flow. As a result, patients may feel a racing heartbeat, palpitations, or pounding in the chest. Symptoms like dizziness, chest pain, or shortness of breath may occur if cardiac output is inadequate. In patients with pre-existing heart disease, this condition can escalate into dangerous arrhythmias or acute heart failure. A particularly critical situation arises when a blood clot forms within the heart chambers, most often seen in patients with atrial fibrillation, valvular heart disease, or after a heart attack. These clots can travel to the brain, causing a severe ischemic stroke. If any unexplained cardiovascular symptoms develop, especially after trauma, surgery, or in the presence of risk factors, a comprehensive cardiac evaluation is essential. This includes electrocardiogram, or ECG, echocardiography, D-dimer testing, and vascular imaging, effective measures to prevent blood clots. To minimize the risk of developing blood clot, each individual should actively implement the following strategies. Stay physically active. Avoid sitting or lying still for extended period. Take 5 to 10 minutes every hour to stand up and walk around gently. When traveling long distances by plane or car, regularly rotate your ankles and stretch your leg. Stay hydrated. Dehydration thickens the blood, increasing the risk of clot formation. Aim to drink 5 to 2 liters of water daily, or more if you're physically active or in hot weather. Avoid smoking. Nicotine damages the vascular endothelium, promoting blood clot formation. Smoking combined with birth control pills significantly increases the risk of DVT and stroke, especially in young women. Manage chronic conditions. Diabetes, hypertension, dyslipidemia, and obesity are major risk factors for blood clots. Follow medical treatment, along with a healthy diet and regular exercise, to maintain long-term control. Use anticoagulants appropriately, recommended for individuals with a history of thrombosis, after major surgery or prolonged hospitalization. Never start or stop these medications without your doctor's guidance. Conclusion: blood clots are not rare, but the real danger lies in their silent progression, often going unnoticed until they trigger serious complications like stroke, heart attack, or pulmonary embolism. This means, sometimes, your life may hinge on recognizing a single warning sign. You might be ignoring a slight calf pain, a momentary racing heartbeat, or a vague chest discomfort. But don't let complacency cost you. Listening to your body is the first step to protecting your life. Always remember, prevention is easier than treatment. With just a few lifestyle changes, such as moving regularly, staying hydrated, managing your chronic conditions, and never dismissing unusual symptoms, you are already taking a big step toward keeping your blood flow smooth and your body healthy. If this video has helped you understand the warning signs of blood clots, share it with your loved one, friend, or anyone at risk. You might be the one who saves a life. And don't forget to subscribe to the channel and turn on the notification bell so you won't miss more valuable health insights, shared by experts in an easy-to-understand, practical format you can apply in your daily life. Take action today for your health and for the people you love.